The Health Policy Research Scholars Program really gave me a space to network with scholars from all over the country, with people who have a variety of disciplinary interests that really help us to meet specific goals for creating change within our communities. In particular, trying to finish my doctoral degree in the midst of COVID-19 with two children was an extreme challenge, and having a group of people where we were trained to think about how to use our network to build our writing skills and to create other opportunities for us to gather together and hone those abilities to finish our dissertations was really essential. We received a training in what's called WAGs, or Writing Accountability Groups. And we took that training and we created our own groups that served as like mini hubs of co working space. It was through one particular writing accountability group that met weekly that I was able to get a tremendous amount of work done towards my dissertation and actually finish on time despite tremendous odds with the pandemic and my kids. So, over the past few years, I have been more intentional about bringing together my practical work with my scholarly work. Prior to becoming a doctoral student, I was the founder and executive director of B4U Theater, which stands for Burning Barriers, Building Bridges. It's a nonprofit theater company in Liberia, West Africa, that exists to empower young people to become educated citizens through the arts. And I was pretty quiet about the work that I did with that organization within my actual doctoral program. There's a notion, I guess, in a lot of academia that practitioner work or the actual being out in the field doing the work is not as compatible with having the life and mind of a researcher. Being in the academy is committing yourself to a life of the mind, is the way many feel about it. But being a part of Health Policy Research Scholars and having the ability to think about translating research to policy, and for me, the implications of policy on practice really gave me the encouragement to bring together my practitioner work, my research, so that when I'm thinking about what the policy options are and what kinds of directions policies might take, I'm able to think about what my research says about a particular topic. For me, that's education and educational equity, and also how different policies are actually able to be actionable for the people that they are intended to serve. So my leadership has completely evolved over the last few years as I've really learned to bring my full self and all of my interests and my skills to my research so that those things can come together and make a lasting impact in the communities that I care about. The program itself has evolved a lot in the last few years, so it's hard to think about a particular kind of advice to give to a newer person entering the program. But I think that one of the things that makes a really big difference, an important difference, is to jump in with both feet. Really trust the process, get to know the other people in your cohort, and to get to know the alumni within the program. Let it be a source of support and a place where you can really come together with other people and develop lasting relationships with people that you can trust, with people you can bounce ideas off of, and bring your full self to the process so that you are strengthened to complete the things that you've come to the space to start. Academia is difficult, doctoral programs are difficult, and it was really helpful for me to be able to have a network of people that were not in my particular doctoral program, but understood the trials and the struggles that I was dealing with and could give really helpful advice throughout the process. And also great people to collaborate with for research, for conference presentations, just to read over your writing. All of those things are a reality of the Health Policy Research Scholars Program, and one that I really hope that new members of the cohorts will take advantage of. That when we think about the way We understand what knowledge, what expertise, and what best practices are, that those ways of knowing are informed by local communities. So, in building a culture of health and doing the work of creating a culture of health, it's important to include communities within even creating a definition of what it means to live a healthy life and to live a life that people have reason to value. Within my particular community, which actually spans Africa and its diaspora, I'm really interested in thinking about the ways that young Black American youth interact with Black youth across the world and what it means for how they understand the linked ways that systems of oppression through colonialism, through slavery, work together to maintain systems of oppression today, and how much in common Black young people have across the globe to engage in new ways of lifting their ideas of what it means to live a healthy life and how they're able to do that through the arts in particular. I really feel that part of a culture of health that is sometimes overlooked is the cultural environment or cultural atmosphere that young people lead in, which is cultural arts production, and giving them a space to amplify their voices on matters that concern them, on things that they have a real opportunity to change, is in many ways how they define what it means to have a healthy life. So, if we're thinking about a culture of health, we really need to think about culture and the arts and how people are redefining what it means to live a healthy life.